regulating hormones. Again, you can apply these elements really if your hormones are not very regular. So that might be if there's a bit of red S going on. It might be if you're postnatal, or if generally your cycles are a little bit all over the place. How do you regulate hormones? Again, there's a little bit of overlap with Emma a little bit later on in terms of nutrition. But the main key things, certainly that Michelle Lyons was talking a lot about, are getting adequate sleep and rest, good gut health. She's quite obsessed with bowel movements, is Michelle Lyons. So there's a lot on gut health, and there's quite a lot of evidence around at the minute with gut health and brain health, the link between gut and brain as well. So good diet and hydration levels, stress management and movement. So again, looking at your cardio, strength training and mobility work as well. It sounds quite simple and straightforward to say those things are the list, but in essence, that is sort of the things that you can cover before you might have to look at anything more medical or with any other medical intervention. So if you've given all those things a go and things are still not quite right, then certainly do get them checked out. For sleep, we're going to cover a few bits for general population, postnatal women and perimenopause, because there's some slight differences that occur at those life stages. Generally, when we sleep, that is when our recovery happens. So it gives your cardiovascular system and heart a chance to rest after your training, however intensely that may be. And that's also when your cell and tissue repair happens. Muscles generally release protein-building amino acids into your bloodstream, generally at an increased rate as well during sleep. And that's when it promotes your muscle hypertrophy, so the increased growth of muscle cells. Ideally, you're looking at somewhere between 7 or 8 hours. Some postnatal women might be thinking, no chance. But if you're getting 4 to 5 as opposed to 7 or 8, it can be detrimental to your body's ability to maintain muscle mass. So it can be tricky to balance. But your heart does like consistent and regular sleep. So if you're experiencing insomnia, sometimes that can have links with other issues like high blood pressure or heart disease as well. So trying to tackle sleep management things I'll cover in a little while, but trying to improve quality of sleep is quite key. For postnatal women, in that postnatal period, if you're breastfeeding, particularly, estrogen levels remain low. So it is one of the ways your body naturally tries to prevent pregnancy. However, that's not necessarily foolproof. So don't rely on that as a form of contraception. But that can have an implication on activity levels and energy levels from the lower estrogen levels, but also your poor sleep. And maybe impact on training and exercise as well, or at least the motivation to want to do it. Sleep deprivation also impacts on appetite and appetite suppression and satiation. So you've got two different hormones, leptin and ghrelin, which monitor your appetite and suppression. And they can get a little bit off balance when you're not getting your normal sort of circadian rhythm, sleep cycle occurring. And also that can sometimes lead to insulin sensitivity. And that is when the body's not able to clear excess sugar from the blood using insulin. And insulin is released from the pancreas after you've had more of a sugar-loaded food. So occasionally that can lead to insulin regulation or insulin sensitivity issues as well. Occasionally, for those reasons, it can then be a little bit harder to lose weight. So there is some evidence that getting good sleep can help with some weight loss. Again, it's more through the other effects of balancing hormones as well. There may be some increased risk of tendinopathies. Often postnatal women, certainly that I've seen in clinic, have often come with things like decurvins, which is where you get your thumb extensor tendons get a little bit uncomfortable, often from lifting a baby that is continually growing. And so the repetitive loading and lifting, again, when estrogen levels are a little bit lower, might contribute to some of that aggravation of symptoms. So obviously as sleep duration increases, things will start to regulate a little bit better for hormonal function and also tissue repair. For the perimenopause group, there's a few points that changes in estrogen and progesterone levels can also lead to disrupted sleep. But that can then have more of an impact on day-to-day mental clarity and possibly also sports performance as well, if you're looking at your training or your competitions. It's about 39 to 40% of women experience sleep disturbance, so it's actually quite high, quite a chunk of the population. So it can influence lifestyle and day-to-day activities quite significantly. The long-term sort of sleep disturbance, they can have a bit of a increased incidence of certain other comorbidities, as they're known as, so cardiovascular issues, breast or uterine diseases, depression, anxiety, and sometimes also changes in cognitive function, which can affect moods and then have wider implications on social functions, quality of life of patients, people, general public, and that's before you even get to sort of athletic performance. So to manage sleep, there are some techniques, all is not lost. Various things like mindfulness, relaxation, reducing blue light exposure at night time before bed, with reduced screen usage, which is something we're obviously not doing tonight on this call. Having a warm drink, no or reduced levels of alcohol. Try not to do high level intensity cardio for the 2 hours prior to sleep, as that will raise your core temperature. Cool dark room, and then maybe even looking at pre-bed routine. It's something that people often do with small children, but perhaps often gets lost a little bit when we get to adulthood. So there's a few things that can sometimes help. And then if you come on to the good bowel health, gut health, nutrition, hydration. Generally, if you're experiencing constipation and your fibre intake is not adequate enough, or your hydration levels also aren't high enough, and the body becomes constipated, that can have a bearing on certainly estrogen levels or hormone levels. So if you're normally through your cycle, obviously to get rid of excess estrogen in your cycle, your liver will clear out any hormones that it doesn't need. So that's excreted by the liver and then sent down to your bowel to be expelled. If your stool remains in your digestive tract, however, it can actually start to increase reabsorption of those estrogen chemicals marginally. And that might influence some other estrogen-driven issues like fibroids or endometriosis. So gut health is one of those things, as I mentioned, that Michelle Lyons is very keen on encouraging women to establish good gut habits, healthy bowel movements. If you've ever Googled the Bristol stool chart, it gives you a wonderful diagram of the variation of stools that a human body can produce, from liquid out of your rear end to rabbit droppings. You're wanting something roughly in the middle, sort of sausage-like stool really, so that it shows that you've got good gut health, good fibre and hydration levels as well. The other thing to consider is also alcohol intake. There is some evidence to show that there are much greater links between alcohol and breast cancer and alcohol and dementia, more so than HRT and breast cancer, which is something we'll mention in the menopause section, and also more so than sugar and caffeine as well when you're looking at diet considerations. So For perimenopausal, might be something you need to consider the intake for. The other thing is to also look at whether you're kind of wired and tired, as the phrase goes. So are you needing caffeine fixes in the morning to perk you up and alcohol in the evening to calm down? Those are generally not particularly long-term sustainable techniques to overall body health. And so trying to establish a slightly better routine with alcohol intake and caffeine will be helpful for hormone health as well. Plus, that might start to influence exercise performance and daily function. So the last bit about nutrition. So obviously nutrition, protein is quite essential for tissue repair, which we mentioned happens at night time when you're resting and asleep. And we'll also mention that the healthy fats in the diet are quite essential for the formation of sex hormones. So really looking at sort of carbs for energy, protein for tissue repair, and any triggers for gut issues. Emma will probably cover a little bit later on. And then you've got some stress level management. So again, trying to reduce daily stress is going to be quite key for hormonal balance. Elevated cortisol or stress hormones can have an influence on hormone balance overall. Sometimes what can happen is the body can actually start to convert progesterone into other sex hormones, into stress hormones, cortisol and adrenaline. If you're sort of continually exposed to this sort of fight or flight stress, long-term stress exposure. So try to identify any stressors. It might be work, family, competitions that are coming up, exams, children, older parents, other things in life that generally rev that engine of the sort of fight or flight response, so that you're not encouraging your body to convert that progesterone into cortisol and adrenaline that keeps you a little bit more fired up with stress. The other thing to focus on as well for perimenopause, postmenopause, is sort of belly fat as well. So sometimes menopausal women will mention a bit about the middle-aged tired, the sort of with the way the body lays down sort of the fat stores around the central abdominal area, and that fat is actually hormonally active. So generally, as your systemic estrogen declines as you're getting older, your body's trying to find other sources of estrogen, and it will find it there, but it's actually quite a metabolically damaging form of estrogen, that links with high blood pressure, diabetes, and obesity. So it's not really the form of estrogen that your body really wants to utilize, nor really that you want to necessarily have. So looking at management techniques for stress, again, there's lots of bits and bobs out there, but getting adequate support with work, family responsibilities, at any age or life stage, breathing techniques and relaxation, mindfulness apps or programs, self-care, exercise, which the majority of you will probably do regularly if you're on this talk from the Pacers or the Morton Hall Running Club, and also yoga, which can be a little bit more restorative. Movement wise, I mentioned strength training. It's quite a testosterone friendly form of exercise, and it increases what we call your serum testosterone, so your circulating testosterone. Generally it's quite a good form of exercise to do in the first half of your cycle, as we've mentioned. For mobility and maybe premenstrual symptoms, you might want to do more sort of Pilates, yoga, and then cardio, you know, in the latter stage of your cycle tends to be better. But having said that, if you do extreme levels of endurance or mileage, it can actually start to deplete testosterone levels as well in men and in women. So you might want to balance out some of the cardio with some strength training. Equally, sort of ultra cardio distances, running, cycling, can be quite pro-inflammatory as well. So having an awareness of the recovery and rest periods is quite important there. And then when you're coming towards sort of post-menopausal age groups, exercise is quite important for reducing the risk of breast cancers, osteoporosis, osteopenia, which is the precursor to osteoporosis, so the reduction in bone density, and also heart disease. For any physios or coaches on the talk, maybe a consideration for the lower estrogen levels can be associated with a reduction in tensile strength, decreased collagen synthesis, muscle fiber diameter and density, and also increased degradation in tendon tissue. So when you're looking at your training schedules and your programs, have an awareness of those things that can occur in women in that age group. Just make sure that there's not an overloading, overusage, and injury risk associated with that as well. So in summary, so it's quite detailed in terms of the areas on the list, but as we go back to sort of sleeping well, reducing stress, good nutrition and hydration, good gut health, bowel health, and movement really are kind of the cornerstones to hormonal health, and then look into other things if there's still symptoms present as well.